Blood sugar, an essential component for our body. But it can present alterations that, if not treated in time, lead to serious consequences. In today's video, we will reveal 15 alarm signals that your body emits when your blood sugar levels are high, alerting you to the possibility of suffering from diabetes. Additionally, we will delve into 8 early symptoms of diabetes that you should not overlook. Knowing these indicators will allow you to take measures in time to prevent or control this dangerous disease. Health today has become a priority, and understanding the signals that our body sends us is essential to prevent diseases. For most people, when talking about high blood sugar, medically known as hyperglycemia, the first thing that comes to mind is diabetes. While diabetes is the disease most commonly associated with high blood sugar levels, it is not the only one. There are other conditions that may also be involved, such as prediabetes, insulin resistance, and obesity. Diabetes, a chronic disease that affects millions of people around the world, does not appear overnight. Long before receiving a formal diagnosis, the body sends subtle signals that something is wrong with blood sugar levels. While diabetes can be a serious and even fatal disease, it is important to recognize that it is not a death sentence. By understanding the warning signs and taking preventive measures, we can control the disease and improve our quality of life. In today's world, where fast-paced living and unhealthy eating habits are the norm, high blood sugar has become a major public health problem. Millions of people around the world suffer from this condition, often without knowing it until it is too late. Today, many people's dinner tables are dominated by artificial and processed foods, a trend that has fueled a rampant rise in high blood sugar levels. The only way to stop this is to educate ourselves and be attentive to the signals our body provides us. This will help us stay as healthy as possible. If left unchecked, these elevated levels can trigger a silent but dangerous disease: diabetes. Continue with us until the end. You will discover the warning signs and how to protect yourself from the devastating consequences of high blood sugar, as well as the symptoms to pay attention to. 1. Frequent or excessive urination. When blood sugar levels are high, the kidneys cannot reabsorb all the glucose from the blood, so it passes into the urine. This causes the kidneys to work harder to produce more urine, leading to more frequent urination. But what can be considered more frequent? The number of times a person needs to urinate each day varies. However, in general, urinating more than 8 times a day is considered frequent. If you notice that you are urinating more frequently than usual, especially at night, this could be a sign of high blood sugar levels. It is important to note that frequent urination can also be caused by other conditions, such as a urinary tract infection or pregnancy. It's also true that if you drink large amounts of water before going to bed, you're likely to wake up in the middle of the night to urinate. However, if you are concerned that your blood sugar levels are high, it is best to consult a doctor to rule out any underlying problems. 2. Blurred vision. High blood sugar levels can damage the small blood vessels in the eyes, which can cause blurred vision. When blodsugar is high, it can draw fluid from blood vessels, including those in your eyes. This can cause the lens, the part of the eye that focuses vision, to become dehydrated, shrink, and cloudy. This blurred vision can be mild or severe. Blurred vision caused by high blood sugar is usually temporary and goes away when the blood sugar level returns to normal. However, if hyperglycemia is left untreated, it can permanently damage the blood vessels in the eyes and lead to serious vision problems, such as diabetic retinopathy, glaucoma, cataracts, and even blindness. 3. Difficulty concentrating. When blood sugar is high, the body has to work harder to process it. This can lead to difficulty concentrating and affect cognitive function. Hyperglycemia can damage brain cells through a process called oxidative stress. It can also cause inflammation in the brain by damaging brain cells. This can lead to problems with memory, learning, and concentration. If our cells become insulin resistant, they are unable to remove glucose from the bloodstream, and this can deprive the brain of the energy it needs to function properly. If you have trouble concentrating, it's important to talk to your doctor to determine the cause. Your doctor may order tests to check for diabetes or other medical conditions that could be causing your symptoms. 4. Dry mouth. Also known as xerostomia, it can be a symptom of high blood sugar levels. The cause is that hyperglycemia causes the body to produce more urine to try to eliminate excess sugar. This can lead to dehydration, which in turn can cause dry mouth. If this sign of dry mouth is frequent, you should see your doctor because there are other causes that could rule out hyperglycemia, such as some medications can cause dry mouth as a side effect. Certain medical conditions, such as diabetes and Parkinson's disease, can cause dry mouth. Likewise, salivary glands produce less saliva as we tend as. Why so we yimao? Which can cause dryness. Additionally, some bad habits such as smoking, drinking alcohol, and consuming caffeine can cause dry mouth. If you experience dry mouth, it is important to drink plenty of fluids and keep your mouth moist, in addition to following all your doctor's instructions, whether caused by hyperglycemia or another condition. 5. Erectile dysfunction. When blood sugar levels are high for a prolonged period, they can damage nerves and blood vessels throughout the body, including those that supply the penis, making it difficult to obtain and maintain an erection. This is known as erectile dysfunction. It's important to remember that erectile dysfunction is not the only sign that your blood sugar levels may be high, so it's important to talk to your doctor. You may need to make lifestyle changes, such as exercising regularly, eating a healthy diet, and quitting smoking. Your doctor can also prescribe medications or other therapies to treat erectile dysfunction and properly guide you on the way forward. 6. Recurrent infections. When blood sugar is high, the body cannot fight infections as effectively. This is because hyperglycemia creates a favorable environment for the growth of bacteria and fungi. Additionally, high sugar can damage nerves and blood vessels, making it difficult for blood to get to where it is needed to fight infection. Among the list of most common infections in people with high blood sugar levels are those of the urinary tract, infections of the skin, gums, and those caused by fungi such as candidiasis and athlete's foot. It is important that you have a blood sugar test to rule out a high level and be careful with diseases in the pancreas that can affect the severe increase in blood glucose. 7. Slow wound healing. Do you notice that your wounds take longer than normal to heal? While this phenomenon can be due to various factors, such as age or the location of the wound, it could also be a sign of high blood sugar levels, even if you have not been diagnosed with diabetes. High blood sugar can damage nerves and blood vessels, making it difficult to properly transport oxygen and nutrients to injured areas, delaying the healing process. Slow healing may be an early warning sign of diabetes. Don't ignore it. Take preventive measures by monitoring your blood sugar levels, adopting a healthy lifestyle, and having regular medical checkups. The doctor will be able to evaluate your case, order tests to determine if you have diabetes, and, if so, recommend the appropriate treatment. Proper monitoring, along with proper wound care, can help prevent complications and promote faster healing. 8. Stomach problems. Have you felt bloated with stomach discomfort or nausea after eating? While these discomforts can be due to various causes, such as indigestion or food allergies, they could also be related to high blood sugar levels. When blood sugar is high, the body cannot process it efficiently. This generates a series of imbalances that can affect the digestive system. When blood sugar levels rise, the body releases hormones to try to lower them. One of these hormones is amylin, which affects the way the stomach empties and food passes into the small intestine. When amylin levels are high, stomach emptying slows down. This can cause a number of uncomfortable digestive symptoms, such as bloating, cramps, nausea, and vomiting. 9. Constant fatigue or extreme tiredness. These can be subtle but important symptoms of hyperglycemia, a condition characterized by high blood sugar levels. When the body does not produce enough insulin or cannot use it effectively, glucose builds up in the blood and cannot reach the cells, leading to a series of negative consequences. This deprives cells of the energy they need to function properly, which can cause a variety of symptoms, including constant fatigue or extreme tiredness and depression. Likewise, fighting infections requires energy, which can cause constant fatigue if your blood sugar levels are high. 10. Excessive thirst. Also known as polydipsia, it can be an early symptom of hyperglycemia, a condition characterized by high blood sugar levels. When blood sugar rises, the kidneys cannot filter out all the excess glucose efficiently. This causes glucose to leak into the urine, creating an osmotic effect that draws water from the bloodstream into the urine. This increases the frequency of urination, which can lead to dehydration. To compensate for dehydration, the body feels thirsty and increases fluid intake. You might wonder, how much thirst is too much? The amount of fluid a person needs varies depending on their age, activity level, climate, and health. In general, it is recommended to drink about 8 glasses of water a day. However, if you feel the need to consume more water and experience excessive thirst, even after drinking fluids regularly, it is a warning sign of a possible rise in blood sugar. 11. Dry and itchy skin. When there is poor blood circulation, itchy skin occurs. The skin loses moisture and elasticity, becoming dry and flaky. This is due to dehydration caused by frequent urination, as the body attempts to eliminate excess glucose through urine. The most common areas of the body that suffer from itching are the lower parts of the legs, and it can cause various problems that go beyond aesthetics, negatively impacting the quality of life of those who suffer from it. Dry skin, also known as xerosis, is one of the most common and early signs of diabetes. It affects approximately 25% of patients, causing a variety of problems that go beyond the peeling, loss of elasticity, and thickening of the skin mentioned above. 12. Increased appetite. Despite eating food, glucose does not reach the cells, generating a false feeling of hunger. Increased appetite, also known as polyphagia, is a common symptom of hyperglycemia, a condition characterized by elevated blood sugar levels. When this occurs, the body does not use insulin efficiently to convert glucose into energy. This buildup of glucose in the bloodstream sends false signals to the brain, indicating that the body needs more food, which results in increased appetite. But how does hyperglycemia act to make us so hungry? High sugar levels block leptin, a hormone produced by fat cells that sends signals to the brain to signal satiety. In hyperglycemia, leptin sensitivity decreases, meaning that the brain does not receive the satiety signal effectively, despite having sufficient energy stored as fat. Ghrelin is another hormone that stimulates appetite. In hyperglycemia, ghrelin levels increase, which intensifies the feeling of hunger. It can also affect the production of gut hormones that promote satiety, such as cholecystokinin. This means that even after finishing eating, the person with hyperglycemia may still feel hungry. 13. Excess weight, abdominal fat. Excess weight, particularly abdominal fat, is a common sign of high blood sugar levels. This accumulation of fat, called visceral or intra-abdominal fat, is found around internal organs and is closely related to the development of insulin resistance and type 2 diabetes. Why is abdominal fat a problem? Visceral fat is metabolically active, meaning it constantly releases chemicals that can interfere with insulin action. It also produces pro-inflammatory compounds that contribute to systemic inflammation, an additional risk factor for chronic diseases such as diabetes, heart disease, and some types of cancer. While total body weight is an important indicator of health, fat distribution is a more important determinant of the risk of blood sugar-related diseases. 14. Nervous problems. When blood sugar levels stay high for a long time, it can cause damage to the blood vessels that deliver oxygen and nutrients to the nerves. As a consequence, they can be affected and present various disorders, such as neuropathies that can cause a variety of symptoms, including numbness, pain, weakness, and digestive problems. In some severe cases, there is no cure, but treatments are available to control the symptoms. These treatments may include medications, physical therapy, and surgery. 15. Changes in the skin. The skin, as the largest organ in the body, can reveal valuable information about our health. If you start to experience discoloration and certain growths on your skin, your blood sugar may be high. In people with diabetes or at risk of developing it, the appearance of certain skin changes can be an indicator of high blood sugar levels. Paying attention to these signs can allow early diagnosis and the implementation of timely measures to control blood glucose and prevent complications. You may notice dark velvety spots beginning to form, which usually form in areas such as the neck, armpits, and groin. These spots may be an early sign of insulin resistance, a precursor to type 2 diabetes. Hyperglycemia can also manifest on the skin in other ways, such as small rough bumps on the skin, commonly known as goosebumps, and yellowish deposits around the eyes. Now that we have reviewed the main warning signs of high blood sugar, how can we make sure? How is hyperglycemia diagnosed? Hyperglycemia is diagnosed by hematological tests that measure your blood sugar level. These tests can be done in your doctor's office or in a laboratory. There are 3 types of blood glucose tests. A blood glucose test where the patient must fast for 8 hours. Another is a random blood glucose test that can be done at any time of the day, regardless of when you last ate or drank. And finally, the oral glucose tolerance test. For this test, you will be given a very sugary drink and then your blood will be drawn at regular intervals for the next 2 hours to analyze how your body releases insulin and metabolizes sugar. If you are diagnosed with high blood sugar, the specialist will indicate the appropriate treatment depending on its cause and severity. In some cases, lifestyle changes such as a healthy diet, regular exercise, and weight control may be enough to control blood sugar. However, many people with hyperglycemia also need to take medications to help control their blood sugar level. But as we mentioned at the beginning of this video, it is also important to know some symptoms that you should pay attention to, and that indicate that you may have diabetes and that are closely related to high blood sugar levels. 1. Fatigue and hunger. The food you eat is converted into glucose that your cells use for energy. But to do this, your body needs insulin. If your cells resist insulin, energy cannot reach them effectively. 2. Frequent urination. The average person urinates 4 to 7 times in a 24-hour period. Diabetes raises blood sugar and the kidneys cannot lower it, so the body needs more fluids, which causes more urination. 3. Weight loss. When you lose sugar by urinating frequently, you also lose calories. 4. Excessive thirst. When you urinate, your body uses a lot of fluids. So if you urinate frequently, there is dehydration, which will cause constant thirst and dry mouth. 5. Blurred vision. High blood sugar levels can absorb fluid from certain tissues, including the eyes. If left untreated, diabetes can cause new blood vessels to form in the retina and damage established vessels. 6. Wounds don't heal. High blood sugar can affect blood flow over time. This can cause nerve damage, making it difficult for the body to heal wounds. 7. Tingling in the hands and feet. Excess blood sugar caused by diabetes can damage nerves and cause tingling and pain in the hands and feet. 8. Dark spots on the skin. Acanthosis nigricans is a skin condition that creates dark spots, commonly on the neck or armpits, and is a sign of diabetes. That said, it is important to recognize the early symptoms of diabetes. The difficulty is that most of these symptoms can be so mild that most people simply ignore them. Taking charge of our health is crucial. Opting for a diet rich in fresh, whole, unprocessed foods is the first step in combating high blood sugar levels. In addition, incorporating regular physical activity and maintaining a healthy weight are essential measures to protect our health and avoid the complications associated with this condition. If you experience any of these signs or symptoms, it is important to see a doctor immediately. Early diagnosis can help prevent serious complications. Treatment for high blood sugar usually involves medications to lower blood sugar and lifestyle changes, such as a healthy diet and regular exercise. Pay attention to these signs and take control of your health. Your doctor will always be your best ally. Do you recognize any of these signs? Do you think you could have diabetes? Do you have high blood sugar levels? What do you do to make sure your health is in good condition? I would like to read you in the comments. That's it for our video. If you liked it, Give us a like and subscribe so you don't miss any content. Thanks for joining us!